So, the format of our presentation, I'm going to make some introductions. Mr. Ciampa will present the budget. Dr. Kerry Wolfman, our Chief Medical Officer, will speak briefly about quality and integration. Mr. Hallman, our Vice President of Communications, will be talking about our community health needs assessment. And then I will finish it up with some concluding comments. We have our organizational chart, we have answers to questions, and we have the capital budget all attached.
Use the mic, please.
There, next slide. So introductions. I want to introduce a few folks in the crowd. In the back, we have a few of our nurses. I'm just looking at Alice, and Hillary, and
Deb.
thank you.
Janet.
And Janet's here. And I'm just going to state the obvious. Our nurses are the boots on the ground and care for our patients. And mission critical, and thanks for coming out in support of us. We have Mr. David Fuller, our VP of Human Resources. David Britton. Nobody can fill Steve Ciampa's big shoes, but we brought Dave in as an interim CFO. Peter Igneri, Vice President of our practices. Dr. Kerry Wolfman, our Chief Medical Officer. Ron Hallman, our VP of Communications. Jen Bertrand, our Controller. And to my right, for his fourth and final presentation, Steve Ciampa. I just want to say the numbers speak louder than any platitudes I could offer, Steve. 39 days cash on hand in 2012, 80 days cash on hand in 2016. He has led us to a stronger financial position. Thank you for my other words, Steve. Thank you. Next slide. So, I'm going to start actually by introducing myself. My name is Dr. Fred Kniffin. I've been at this table before, but never in this role. I worked my first shift in Florida ER in August of 1990 and have been there ever since. I've filled a number of roles. This winter, I finished up a 4-year stint as the Chief Medical Officer, and my plan was to get back to my roots of being a work hard, play hard ER doc. That lasted 2 months. On March 18th, I got a call from our board chair. They were looking for someone to act as the Chief Executive Officer on an interim basis. It's a huge honor. It seemed like the right thing to do. I thought about it for a few hours, talked to my wife, and the rest is history. I just want to talk a little bit about what it was like back in March. My first day at work was Monday, March 21st. We employ about 60 providers, about 20 some odd primary care providers. 10 of them were going or gone. All of those 10 were in primary care. We used to employ 8 internal medicine providers. We were on track to employ 2. The losses were focused in downtown Middlebury, where most of our patients receive their care and our most vulnerable patients live. We employ about 140 nurses, and 40 were going or gone. I think you all know we're a 25-bed critical access hospital. There were times last winter into spring when we simply could not care for 25 patients. We could not meet our mission of caring for our community. So it was apparent to everyone that rapid action was required. We needed to stabilize the place and stabilize it quickly. We needed to start a rapid rebuilding process. We needed to communicate. When we thought we'd said everything to everybody, then it was time to communicate some more. And we needed to do all of this while we were keeping the doors open, patients are coming and going, and we're caring for our community. You know, it was clear to me as a long-term employee what the solutions were. First of all, we needed to value and respect our employees. And when I say that, I mean all of our employees, top to bottom. Our workforce was feeling a little disrespected, a little undervalued, at times disenfranchised, and a bit dispensable. And when you have mobile employees who feel dispensable, they dispense themselves. And that is exactly what happened with our providers. Who is more mobile than a primary care provider? They have opportunities everywhere. And they seized those opportunities and moved on, northwest, east, and south. Our nurses were hot on their heels. They also have opportunities, and they were moving on. We needed that to stop. You know, the solution seemed like an injection of value and respect, and we've tried to walk that walk for the last 5 months with some success. You know, the other thing we needed to change was style. Top-down wasn't working. Doesn't work for me very well when I'm at the top, and it really works poorly for me when I'm at the bottom. And we had to change that. And we did not give up our power to manage. We continue to have good ideas, but instead of implementing them without soliciting feedback, we go to our people, we tell them this is what we want to do, this is why we want to do it, this is how we'd like to do it, what do you think? Is this a worthy idea? Is this the right way to do it? You do the work with us, help us, let's do these things together. It takes more time up front, but we're saving time on the back end. We don't have to clean up all the messes, and we create real change. So that's what we've been trying to do for the last few months. I'm happy to say we're making progress, but I want to be clear on this message. It's incremental progress. It is not mission accomplished. It is not an exuberant message. We have lots of work to do and many challenges ahead. But we are making some progress. I call it 2 baby steps forward, 1 baby step back each week. Specifically, we just did an employee engagement survey. We found out that overall, board-wide, our employee engagement is exactly where it was in the fall of 2014. I find that nothing less than a miracle. On the recruitment side, it was a little scary back in March, April. I tried to put on a calm face, but inside, I wasn't sure we were going to be able to get people to come work at Porter, providers or staff. And we found that people still want to come to Porter. They want to come to Porter for the same reason that we all came to Porter. Great place to work, best place you ever want to live, great place to be a patient. Specifically, we've hired between 6 and 8 new providers since April 1. It's a hard number to keep track of, it's fluid, they're all in primary care. We've hired 35 nurses since the first of the year. The rumor is that we took a bus down to graduation at Castleton and loaded up the senior class. That's just what I've heard, don't know if it's true, but if you want to feel old, come on down and walk around with some of our young nurses. I'm sure you want to feel old. And you'll see that we have some really excited young talent in our nursing staff. You know, so we're making progress. You know, I think the most powerful source of optimism for me has been our community. And I've often said that our community views Porter Medical Center like their professional sports team. We're like the Red Sox in Boston. And when we're winning, everybody basks in the glove. And when we put up a couple of losses, they're not amused. And last winter, they were downright angry, pitchfork angry. And I was stunned. As soon as we got out there and said, we want to communicate, we want to share news with you, and we want to listen to you, they pivoted. As soon as we recognized that we had violated their trust and lost some of their respect, and we wanted to rebuild it, they just pivoted 180 degrees, and they've been with us ever since. And what's clear is that when you don't have your community and you don't have your staff, you're not going anywhere. When you have your community in the boat and your staff behind you, it is a strong tailwind, and that's what we've experienced for the last 5 months, and I think that's really the biggest credit to the progress we've made. This is a budget hearing, so I'm going to talk a little bit about the budget. You know, I started again late March, early April. I've done this work long enough to know that's budget season. So I went straight to my colleague and friend, Mr. Champ, and said, where do we stand on the budget? And he said, we've had the groundwork going. That was reassuring. I slept for a few more nights, But we talked, and we were perfectly aligned. Our goal for this budget was boring. We wanted to put together a plain, vanilla, boring baseline budget. Let's not try and rebuild this franchise in one season. Let's create a budget based on conservative, reasonable assumptions that we're confident we can execute. Let's not put ourselves in the position of having to pull rabbits out of the hat every quarter all through FY17. Let's build something reasonable that we feel good about, and that's what we're here to present today. So I'm going to turn it over to my friend and colleague, Mr. Champlin.
Thank you, Fred. I think